Okay, let's start. All of you might be knowing the shlok. Am I audible to all of you and visible to all of you nicely? Okay. Since you all are muted, you can thumbs up for yes or no, that type of things you can do. Okay, so the shlok or the verse is Om Sahana Bhavatu. You might be knowing, or if you are not knowing, just listen to it. Okay, breathe in, breathe out. Om Sahana Bhavatu, Sahanau Bhunaktu, Sahaviryam Karvavahe, Tejasvinavadhitamastu ma Vidvishavahe. Om Shanti Shanti Shanti. Again, breathe in and breathe out. So, today we are gathered together in the new year. So, from my side, Happy New Year, a warm welcome in this new year. And see, this session is going to be a more interactive session since I am a psychologist. I am a listener and I want to listen from all of you, right? So, it is going to be interactive whenever, see, many participants are there. Nobody, I mean, everyone could not get the chance, but whenever I'll ask the question, I would like to hear from you. And the question interactions will, the discussions, things will gather more information and we will learn more, right? As of now, yoga therapy webinar, and as of now, I know what Shubha Yoga Foundation is giving us, all of us, is a best path, and they are providing us the best platform for learning all these things, right? Many of you might have joined Shubha Yoga Institute. Many are new. I don't know who all of you are, but since Shubha Yoga Foundation has created this platform, it's worth joining it. And that's why I congratulate you, all of you. You might be thinking, why congratulations? Because that thought inside your mind arised of joining this session. Because not only that thought arised in your mind, you decided, that decision came into your mind and you decided to join this webinar. So that's why I'm saying congratulations to you all. I might not see the chats while talking because please open your camera. Who is saying this? My camera is off.
No, your camera is okay.
Okay. So all of you open your camera. That's why maybe the message is there. So we were talking about the verse. Let me introduce myself first. Some of you might be knowing me, some of you not. So let me introduce myself first. Suchita Kumbhar. Currently I'm staying in Dubai, but I'm originated in Maharashtra. So Maharashtra Santanchi Bhumi. So many of the abhangas and shlokas will be there in my interaction, maybe, may not be. Yes, I am master's in psychology. I have done my counseling psychology from IGNOU University, and applied behavior analyst that I have done in Dubai, UAE. That is the KHDA approved. And I'm working in Dubai in a reputed school for behavioral children. I mean, as a psychologist and as a behavior analyst, I'm looking after and I'm supporting the disabled children. I'm supporting them to learn, to counsel them, and of course to grow and expose them towards the environment, towards the nature, we can say. So this is about me. International yoga therapy I have done, and then all of the information is okay. But the most and deep information about myself, or you might think, or you might give about yourself, is I am a human being experiencing the life, and that is the best information about ourselves we can give, right? It's my opinion, of course. So we all are the human beings and the souls experiencing this life. Now we are gathered together for the yoga therapy session. I mean learning yoga therapy. So of course we are going to talk something about yoga and something about yoga therapy. Before that, I would like to ask 3-4 questions. This whole session will be introductory plus interactive plus we will discuss something about, what we are going to learn all over the 1 month duration of course. So what will be the content? That will be our one part of today's session, and 3-4 questions we are going to discuss. That questions are, so be ready with your answers. Some of you might answer when I unmute your mic. So the questions are, what do you understand by yoga? Of course, that will be the first question. Many of you are yoga teachers, yoga practitioners. Many of you might be training the teachers like me. But that question arises when we discuss about yoga therapy. So what do you understand by yoga? Even if you don't get a chance to answer live on this session, you can write it down, because these questions these questions will help you to understand the yoga therapy and to understand our human life. So one first question is, what do you understand by yoga and yoga therapy? Second question we will discuss in today's session will be, if you are a yoga therapist, now you have joined the course, so and attending the seminar, you are thinking that yes, I will be the yoga therapist, maybe my clinic will be there, or maybe clients will come to me. So that thoughts are there inside your mind. So if you are today a yoga therapist, are you supposed to prescribe the medicines, or what should you supposed to prescribe for the patients coming as a yoga therapist to you, right? When the patients will come and see yoga therapist in you, what will be you doing? That is the question. Okay,
Sorry,
some
I
answers are coming. Yoga is a balanced mental state in chat box. Very
check.
nice.
Please.
Then third question will be, what do you mean by health? Because we are learning yoga therapy, we should know the basic definitions of health. And the fourth and last question we are going to discuss is, what is a disease? Right? Because therapy, we are pronouncing therapy. In the sense, we must know what is health, what is the definition of health, and what is disease. Yes, diseases, illnesses, sicknesses, many I mean lot of diseases are there, but do we know exact definition or exact meaning of disease? That we are going to discuss. So our session started with a shlok, Om Sahana Vavatu Sahano Bhunaktu Sahaviryam Karvavahe. You might be knowing the meaning of this shlok, but while learning purpose, if we want to know the meaning I will tell you first, and then I will send you, if you are joining the session, I'm going to send you these all things, running notes and all things in the WhatsApp group if you are registering with the course. So Om Sahana Vavatu Sahano Bhunaktu, the meaning is, may Guru and disciple be on the path of learning, be on the path of success. Now here we all are disciples. Though I am here to teach you, or though I am here to discuss all the things about yoga therapy with you, and you are sitting or listening as a student or as a disciple, I am, from my side, I am saying I am not a teacher. I am not going to teach you anything. Why I am saying that? Because I feel about all the universe is teacher, and he or the almighty or the cosmic energy teaches all of us. So that cosmic energy is a guru, is a teacher who is teaching us, and we all as a disciple are learning. So that cosmic energy and our connection arises here as a platform of Shubha Yoga, on the platform of Shubha Yoga Foundation. And this energy is going to teach us a lot. So that is why I am saying that the guru and disciple, where is this guru? This guru is within, but we should align ourselves with that universe or with that higher self or with that cosmic energy to learn many things from it, right? So this is the yogic paribhasha, we can say. And then guru and disciple on this path may get success. Whatever we study, whatever we learn, whatever we work together may get success. That this verse is saying. That's why every session of mine will be starting with this shlok only. Okay. So this was about Om Sahana Bhavatu Sahana Bhunaktu. Now we will discuss about what is yoga. So those who are, I'm unmuting some of you. Those who want to answer, please raise your thumbs up. What is yoga? We are going to discuss. And till one is telling his opinion, one of I mean, I will unmute some of you, right? So till he or she is going to tell his opinion, you may write it in the chat box so that all opinions will be there, full of opinions. We will discuss the theory. So here I can see hands raised. Okay.
Madam, namaste. Hello.
Actually, many participants are there. Subha Yoga. Shubha Yoga. Okay, say. You are unmuted. Please. Are you going, Shubha Yoga, are you going to tell us something? Okay, I'll unmute some other one. Deepa Jagdish, please let us know what is your opinion about yoga.
Yeah, I think yoga is a discipline, ma'am.
Sorry, we could not hear you. Discipline. Yoga is discipline, you said?
Yes, ma'am.
Okay, good answer. One or two more will answer so that we can move ahead.
And also, it's self-care.
Okay, Deepaji. Thank you very much. Mute yourself now. And one or two more. Here I can see Sujan Sen Gupta. Can you please give us the opinion about yoga?
Good evening, madam.
Yes.
I am from Bangladesh.
Actually,
I am still traveling on the way.
It's okay, no problem.
So I'm connected
no
with yoga. It's a very, if I say in one word, that is the connectivity.
Great.
Maybe the connectivity between Supreme Soul with the individual soul, and lots of things. But at this moment, I am feeling that I am connected with you from another country. That is the gift of yoga.
Right, exactly, sir. Because yoga, the meaning of yoga itself is yujya. Hana samatvam yoga uchyate. So that what sir was saying, it was exactly same connectivity. Yoga is Atma ka Paramatma se milan hota hai. Very good. Somebody has written it in chat box. So this is how we are going to discuss. This was an example, and that question, whenever I will ask question, 2-3 opinions I will expect from you. So yoga, in my opinion, is Dehatma Yoga. This word is Hindi, Sanskrit, you can say Marathi. Dehatma Yoga. It means Deha Atma. Deha means body. Atma means soul. And there is one verse in Marathi. Marathi in the sense Prakrit language. So after Sanskrit language, Prakrit language came, and after that all languages arose. So Bhasha Vedascha Vartante, any type of language is there, meaning is we need to learn, right? So there is one verse, Eke Vina Eka Kahi, Kama Naye Vaya Zaya, Manoni Ha Upaya Dehatma Yoge. So what is yoga actually? It says our body is dependent on soul to experience the life. See, very meaningful verse it is. Our body is dependent on soul to experience this human life or this life, and vice versa. I mean, the soul also is dependent on our body to experience the human life. And that's why, unless and until body and soul are aligned, whatever we are experiencing in life is not aligned with the higher self. Till now, from our birth till now, we are exposing to many things and we are experiencing many things. But as and when we align with our higher self, and what is our higher self? Our identity. Because we are used to stay like a jeev, sukshma jeev, jivatma, we can say. And we are supposed to live like a higher self, Paramatma. We are supposed to experience the life like Paramatma. That's why our birth, when we took a birth on this earth, but why this birth is happened to us is the question. And when we get the answer to this question, we try to get this answer that why I'm here on this earth, why I have taken birth. This question arises in our whole life. At one moment, this question will arise. If it is arised, you should got an answer. If it is not arise, it will arise meanwhile any time in your life, right? So Dehatma Yoga is the concept I was telling about, and body and soul are, if they are connected or aligned with our higher self, with our identity, that is called Yuj, Yoga. And that yoga means uniting with knowledge, uniting to the God through our knowledge. जो भी हमें ज्ञान होता है, ज्ञान आता है, हम ज्ञान, knowledge gain करते हैं. We are gaining the knowledge, right? So correct knowledge, incorrect knowledge, that is another part. But whatever we gain through our knowledge and we unite it through to the God, through the knowledge, then it is called Jnana Yoga, right? So Jnana Karma Bhakti, you all might be knowing, that is Yoga. Jnana Yoga, Karma Yoga, uniting the higher self or that cosmic energy or that God, as we say, through our knowledge, through our karma, I mean the actions, whatever we are doing in this life, in this human life, of course, and through our devotion, uniting to the God or higher self through our devotion is called yoga. Jnana Yoga, Karma Yoga, Bhakti Yoga, and as a yoga science, we are supposed to learn the Ashtanga Yoga, right? So this was about Dehatma Yoga, and this is my opinion about yoga science. Now, yoga is science, that we all know, but how can we relate it to therapy? Because see, as a therapy or as a therapist, I just now asked that if a patient comes to you, that was my second question. If a patient comes to you and now at this moment you are a yoga therapist and that patient is supposed to ask you something. So whatever he is going to ask you, that we don't know. But are you feeling or are you supposed to prescribe the medicines to that patient as a yoga therapist? So that is the question. Since time is moving ahead, I'm going to discuss it, but one or two answers I want from you. I also want a break, right, while talking. So I want to listen from you. Can I ask Desi Mohan? Are you ready to answer this question? As a yoga therapist, if patients come to you, are you supposed to prescribe the medicine? And if not medicines, what you will prescribe as a yoga therapist?
Thank you,
Please.
ma'am. Thank you for the opportunity. Honestly, I'm a physiotherapist by profession.
Very
I
good.
recently have started my clinic. So, as a physiotherapist, I don't subscribe any medicine. And of course, as a yoga therapist, also, I won't subscribe. Uh, sorry, prescribe. So, the thing that I can do as a yoga therapist after completing the certificate will be some asanas related to their conditions, like lower back pain. So, and I will tell them which asana not to do and which to do and how to do and the correct posture and everything. So, which I'm also doing right now as a physiotherapist. But
Exactly.
after completing this certificate, I think I'll be more clear about it in a deeper level.
Exactly, exactly. That is what how we should think. Since I am also a psychologist, I am not supposed to prescribe it, any medicine. Psychiatrist is different and psychologist is different. Physiotherapists also are not supposed to. I think some of us I are supposed to prescribe the medicines. But when you become a therapist, like psychologist or physiotherapist, anything, you are not supposed to prescribe, but you are supposed to give the alternative medicines for them. That's why yoga therapist, as a yoga therapist, we are not supposed to prescribe medicines, but we are supposed to prescribe. So this word I'm using, prescribe, is very important, because when we are going to tell them, the patients, tell the patients, yes, you have to do these asanas, do these pranayams, or many spiritual anatomy we are going to learn in this 1 month duration. So whatever you are writing or whatever you are telling them, it will be like a prescription to them. As a yoga therapist, you are going to tell them, because daily practice or daily practicing yoga is different, and yoga therapy, when you are relating it with therapy, you have to prescribe. Before many years, it was like confusion in the sense, how can we call yoga as a therapy? That type of discussions were there, because allopathy has the pathology, homeopathy also is the paths, then ayurvedic also are supposed to prescribe the medicines, so pathy. So everybody is, allopathy, ayurvedic also pathy, and then homeo also pathy, homeopaths. So everybody is doing something experiments or doing something studies on, I mean, case studies will be there, and then prescribing the medicines. But as we move on, and as a yoga therapist we move on, we are supposed to prescribe the asanas, pranayamas, mudras, bandhas, and whatever we are going to learn in these therapies. So when we prescribe, that means we should know about the patient's health issues, about the patient health, right? And that's where the third question arises. What do you mean by health? You should know the meaning of health. And this all discussion is going to give arise to a new opinion about the yoga therapy, right? So anyone of you can tell me the definition of health if you know. If not, we are going to discuss. Please raise your hand so that I can move on. Sapna Arora. You can mute, Sapna ji, please.
Yeah, ma'am. Mm, um, about the health, nowadays, we can say health is the mental health, health is your physical health, health is your social health,
Yes,
health is your environmental health, health
correct.
is your diet, and health is everything is in health. That is not the only the eating pattern or only the exercise. Health means overall well-being.
Yes,
So that you can attach yourself with the supreme power also.
exactly. So one more opinion we'll take. Sapna ji has given a very nice opinion. Anita Agarwal ji. Are you ready to give your opinion about health? Okay, no issues, ma'am. Geeta ji, your video is off.
Emotional
Sujata.
stability. Emotional stability I
Em-
define as health.
Somebody
When
is saying,
emotion
I don't
with
know.
feelings No, with only the feelings, the diseases arises. Each emotion creates a disease. So
Exactly.
emotionally, they must be balanced.
Wonderful, wonderful, Geeta ji. Thank you for your opinion. And I was asking Shri Ram Sujata ji.
The well-being. I mean, it depends on the body, on the mind. I mean, physical, spiritual, emotional, and mental.
Exactly, exactly. So we are very close to the answer given by WHO. There is a definition of health given by WHO, World Health Organization. I will share this all things whatever I have discussed with you once you join the course. So World Health Organization has given the definition of health is a state of complete physical, mental, and social well-being, and not merely the absence of disease. So earlier, they were used to define health as absence of disease is health. Okay. So originally, as a human being, we are healthy. Originally, we are healthy. And absence of disease was known as health. But nowadays, the WHO also has given the definition of health as the physical, mental, emotional, as Geeta ji also said, and many of you are giving the same opinion, mental, emotional, and social well-being. That is called health. Now, when yoga therapy comes in picture, it came into picture along 80 years earlier, before 80 years it came into picture. Swami Kaivalyananda is the name who developed this yoga therapy in Lonavala Kaivalya Dham. If you are knowing it, in Maharashtra, Lonavala, the Kaivalya Dham Institute is there, and in that institute they did the research on this yoga therapy. So before it was not there, 80 years before I'm talking. But when yoga therapy came into picture, that time they said, they told Kaivalyananda, Kaivalya Dham Institute's person, he told, like, they were used to take the forms, and whoever will write that he is feeling sick or he has some health issue, they were not accepting that person in that institute. So they were thinking, their belief was like yoga therapy is not for people who are unhealthy. So they were not accepting initially the people who are unhealthy. So they are used to take the forms and fill up with the patients, with the clients which approach that institute. And initially they were not taking. But one day it happened, like, though that client approach to that institute was unhealthy, he did not write it in the form. And that client get admitted in that institute, right? So after 3 months of practicing yoga, so that institute, nowadays that institute is well known. If you search in Google also, you will get to know the Kaivalya Dham in Lonavala. They have made the hospital for yoga therapy. Okay. But initially they were not accepting the people with health issues. So that story I'm telling you, initially they were not accepting that clients as they were unhealthy, but the person who did not fill up the form for his health issues and approached that institute and started practicing yoga with them. In 3 months of practicing yoga, he only told that institute's person, that manager or somebody will be there. He told that I had these health issues, and because of practicing 3 months of yoga, I cured from this disease. So this is the story. But after that, that Kaivalya Dham Institute and Kaivalyananda ji started researching about yoga therapy. And after that, the yoga therapy is developed. And this has happened before 80 years, I'm talking about. And nowadays, yoga therapy came into picture, like, everything. And we must say that it is like, as we, after 10 years, as we think of, the world, or we can say the universe, will be aligned with yoga, or yoga will attract the universe to align with the higher self. So this is how yoga therapy came into picture. And the definition of health, WHO, that also tells us that the mental, social, emotional, and physical well-being is called as health. And in addition, WHO tells us that ability to lead socially and emotionally productive life is called as health. Right? Now, Ayurveda also gives the definition for health, and that definition is, it is written in Sanskrit actually, and it is very, very easy to understand. Why I am telling this? Because this Ayurvedic definition of health itself tells us why yoga therapy exists. So that definition is, many of you might be knowing, samadosha samagnischa samadhatu malakriya. This is for body, physical body. Prasanna atma indriya mana swasthya iti abhidite. I'll repeat it again. Samadosha samagnischa samadhatu malakriya prasanna atma indriya mana swasthya iti abhididyate. It means, what it means is, if it is possible, I can share the screen here, but it will waste our time. So we will move on. So what it tells us, samadosha. So you might have heard the word dosha. We are going to learn in this 1 month course all of these things. Vata, Pitta, Kapha, right? These are called doshas. So balancing of these Vata, Pitta, Kapha, balancing our doshas, samadosha, samagnischa, Agni comes into picture, means heat circulation comes into picture. So related to Agni, means our digestive system, we can say, right? Metabolism system, we can say. So samadosha, samagnischa, samadhatu. In the dhatu, they are supposed to talk about our physical body and what body is made up of all the elements, right? So these elements you might be knowing. In Mudra therapy, we used to say Prithvi, Apa, Tej, Vayu, Akash, Samadhatu, Dosha, Agni, Dhatu, and Malakriya, excretory. So excretory system is very, very, very much important in all of the pathies. Though it is allopathy, though it is homeopathy, though it is Ayurvedic, or though it is a yoga therapy, or though it is a psychology. Any kind of therapy, any kind of studies, we can say, Malakriya means excretory system is very, very much important. And that process is going where? Our physical body. And now this is physical, was about physical body, balancing our physical body. And now it comes prasanna atma indriya mana. Prasanna, it means bliss. So dosha, agni, dhatu, and malakriya should be balanced. And prasanna means blissed. What? Our atma, indriya, and mana. So mind, atma means our soul, and indriya means our organs. Self-awareness, self-development, and reaching towards the higher self is very, very much important while learning yoga therapy also, and while practicing yogas also. So before our session started, I asked you to breathe in and breathe out. Only breathing and breathe out. But I ask you to observe where you are breathing in, while you are breathing in, where the air is going. You are inhaling the air inside through your nose, and is it filling your stomach or your chest? So see, we are breathing. Daily basis we are breathing. But while breathing, if our breathing is like, or our breathing is with our stomach, belly breathing it is called. Very simple experiment it is. You all can do it at your home. As we were we taken birth and we started growing. But as we were baby, in the baby, we can say 6 months age or 9 months age, that age we were breathing with our belly. And as we grown up, we started breathing with our chest. Now try to observe. Regular breathing is happening. You breathe in, breathe out with your chest, which is very little amount of air we are inhaling and little amount of air we are exhaling, which is not useful for our health. Why I am coming to this point? Because we are talking about prasanna atma indriya mana, and there that prasannata, that blissful state of our soul, blissful state of our mind, and blissful state of our atma, soul, indriya, organs. So with this nose, we are breathing in and breathe out. Is this organ, are we aware of this organ? Because it is a natural call, we are not observing at all. We are using this organ from our childhood till now. But are we aware of, are we taking care of this organ? Again, breathe in, it goes where it goes, through our neck or through our respiratory system, and where it reaches through our respiratory system till where it goes, till our belly, where it goes. That is the point. So self-awareness, self-development, many motivational sessions will be there on Google or many anywhere there will be the sessions, but self-awareness is at least you should be aware of your breath. In the 24 hours day, 24 hours of a day, while night, if you try to observe, you are lying down on the bed, what is happening all over the day, we are thinking of, but a little amount of air we are inhaling and exhaling, that we are supposed to observe to reach towards our identity only, to reach and align with the higher self only, but including me, we are not doing it. See, because it is a natural call. When we cry, when we urinate, when we do the malakriya, we are supposed to at least think of it. Who is doing these all things naturally? At least think of it. So this is what self-awareness is about, and only thinking will do, but start thinking about it. These natural causes are processing because of some energy inside you, and that energy itself is the higher self. That's why every session of mine contains this example that I am taking the session, I am sitting on this chair, and if I am dead, I'm not going to dead now, but if I'm dead, who is there to talk? Who is there to listen? Through me. See, this example actually is I'm working in a school. Okay, I'm sitting as a counselor on the chair, and my department is very happy with me. And that department always says, Suchita ma'am, you are so nice, etc., whatever. But on that chair, my dead body, one day there will be, and is the department is accepting me and giving the salary, which salary I'm getting it now, after death I'm getting to, they are going to give me. Are they supposed to give? No. Then my question should be arise. It should arise in my mind. Who is getting this salary as a counselor? Is it me getting the salary, or is it the energy within me? Breathe in, breathe out. That prana shakti I used to call is the energy, and that energy is getting the salary. So this is the prasanna atma indriya mana. This is the awareness. You should be aware of your organs. You should be aware of your mind. You should be aware of your soul. And for that, these yoga practices or yoga therapy will help us to align with. So this was about the Ayurvedic definition, which was in Sanskrit. And now we will move forward for our last question. What do you mean by disease? Now we came to know about health, So balancing of samadhatu, dosha, energy healing is there. We are going to learn now. Now I'm going to discuss the curriculum in 2 or 3 minutes, and then after that you can ask your doubts if about this course or if about anything we discussed now. You can ask me the doubts. So 2-3 minutes I will be discussing about the curriculum, what we are going to learn in one duration. Our last question comes is, what is disease? What do you mean by disease? Any one of you can answer. Just unmute yourself, answer, and then
मैम डिजीज मीन्स डिस ईज, जो
हाँ।
हमारी ease को हटा दे, तो दैट इज डिजीज को अगर हम बाइफरकेट करेंगे तो दैट इज डिस ईज, ईज को डिसेबल करने वाला डिजीज.
Yes, correct. Disturbing ease is called disease. And when we come to discuss about disease, as ma'am said, I think Sapna ma'am said, disease मतलब ease को हटा दे. Ease is what? Health. That's what we discussed. कि originally we are healthy. When we were child, we were healthy. हम मराठी में उसको है ना निरागसता ऐसे कहते हैं. अगर you might be knowing this word, निरागस. It means nothing is there. No health issues, no thought mental disorders, nothing is there. He is healthy, he or she, the baby is healthy. So originally we are healthy. It was ease. But when ease is disturbed, we only attracted disease. And that's why disease is called disturbing health. Normal function of organ is what? It is healthy. So every organ is healthy. When we were in the mother's womb, we were healthy. Yes, some of the wombs get health issues and come to birth. That is by our karmas. That also we are going to learn our spiritual anatomy in our 1 month session. That what are the energy bodies, what are the karmas, sanchita prarabdha kriyamana, what are the doshas, everything we are going to learn, that we will discuss now. But normal function of organ is health, and abnormal function of the same, I mean abnormal function of the organ is disease. Now yogic practices, what the yogic practices does? Yogic practices establish this balance between the normal and abnormal to achieve a good health. हमारे घर में एयर कंडीशन तो अभी सभी घर में रहता है. एयर कंडीशन जब when we brought it new, the day 1 of our air condition, it was very much of chill, cool, very nice air condition it is, we said. But as days and months and years passed away, that cooling of air condition was not seen as the first day was, right? So what did we do? We called the serviceman to service the air condition, right? And after he came, he serviced the machine, air condition. The day 1 cooling and chilling was there after servicing. Same is with our body. Our body, when day 1 we birth, or day 1 we can say that mother's womb, when we were present in mother's womb 9 months, that energy made us very healthy, very much healthy. Though though some of the children when they born with abnormality, because I'm living with them, I'm staying with them daily basis, the disabled children, they are angels on this earth. I need a lot of energy to handle them. I know all of them. So though these children are abnormal and taken birth and due to past karmas or hereditary, whatever they have, but the Jivatma and the soul is there to take care of them. And he is healthy. That Almighty, that higher source, he is healthy. So originally, we all are healthy. But as the past births I'm talking about, days past, before this birth, we had many births. That after that birth, the days passed, then the years passed, that air condition was not giving the cooling as the day one we took the birth. So something should happen in our human life, and it is possible in human life only, and that yoga does. The serviceman comes, services our body, and brings the original health back. And that is why yoga is a process of normalization. And yoga therapy is the process of normalization plus relaxation plus achieving our original health, our original identity. That's why there was a lot of confusion when the yoga therapy was developed. All are pathologies, but yoga is not a pathology. So how can we call yoga as a therapy? But after researches, many of the researches, they proved that yes, yoga is going to help. Every human being will need to practice yoga one day for achieving good health and for achieving his ओरिजिनल आइडेंटिटी, खुद को पहचानने के लिए, खुद को खुद से मिलने के लिए वी हैव टेकन द बर्थ ऑन दिस अर्थ. हमारी खुद की पहचान लेने के लिए ही योगा है. So now we will discuss about our curriculum. In this 1 month workshop, what we are going to learn, as you might be knowing also, this curriculum will include an introduction to yoga therapy, somewhat we discussed today, but from 8th January, Shubha Yoga Foundation course is commencing. I'm going to take this teach these sessions. Then introduction to yoga therapy, understanding of various conditions and diseases. A little bit we discussed today, very little bit we discussed today about diseases. But when a patient comes to you, he's not, I mean, he is coming with many health issues, then what you are supposed to deal with it, that we are going to discuss. Case studies we are going to discuss. Of course, musculoskeletal system, which are related to movement and stability. Then the case studies about muscles and skeletons. Of course, musculoskeletal system, case studies like back pain, knee pain, shoulder pain, circulatory system. Circulatory system means what? There will be blood circulation in our body, air circulation in our body, heat circulation in our body. So cardiovascular, everything, that diseases, a little bit we will discuss. And also the case studies, if patient with a circulatory system having heart disease, having high BP, many diseases it will be having, or the combination of diabetes and BP, then what you are supposed to prescribe the word, keep it in mind. We are supposed to prescribe, because prescription is not like this asanas, yes, go and do. No. One thing I want to tell you is, though we all are learning, when we started our session, I told you that I am not going to teach you. The teacher is different, that is the universe. Likewise, we can say we all are learning, we all are disciple, and in one day we are not going to be a yoga therapist. In 1 month course also, listen it properly and don't take it wrong, okay? We are not going to be a yoga therapist in 1 day or 1 month. Even though we got the certification of yoga therapist and we started practicing as a yoga therapist, we are not called as yoga therapist. Then when we are supposed to call ourselves as a yoga therapist, when we start our clients and when we see each and every client as a book, each and every client as a book, I am saying, because he will be with the health issues, but you are there to learn many things, like which medicine will go. That is decided in the MBBS or BMS, or that theoretical part. They are decided, and they are supposed to give the medicines and prescribe and supposed to do the practice with them. That's why after MBBS take the internship and they go for the internship with many cases, and then only they are supposed to prescribe. But as a yoga therapist, when you will be good enough to do the research and then prescribe. Likewise, before 80 years, that story I told you, before 80 years, that Kaivalyananda ji, Kaivalya Dham Institute, they were not knowing that health issue is there with this client, and that client itself came to that person and told that because of this yoga practice, I got cured of my disease. This is how we also should get an experience. Like our clients should come to us and say that because of these prescriptions and because of practicing these yoga therapy you prescribed, I got cured from my disease. That day we can call us as yoga therapist, because we are supposed to practice with them and we are prescribing them asanas, pranayam, mudras, bandhas, everything we are prescribing, but the result should come out of them and they should come to us and tell us that yes, because of this I got cured. That day we can call us as yoga therapist. So that try to understand what I want to say. And we were discussing about the curriculum. So this is how case studies will be there. If the patient with heart problem comes to us, what are we supposed to give them? What pranayam, what mudras, what bandhas, circulatory system, and the case studies with heart problem, high BP, etc. Digestive system and its case studies. Of course, indigestion, constipation, then excretory system also comes in digestive system. Again, endocrine system, stress, mental disorders. This is my area. We are, yes, with our clients, we are actually practicing yoga. One example I want to tell you here. The client with schizophrenia in the 11th standard he was, and schizophrenia is a disease where we cannot cure this disease. This is a mental disorder. We cannot cure this disease, but we can manage it. Psychiatry was there. Somebody is unmuted. Please mute yourself, my dear friend. And the psychiatrist has prescribed the medicines. He was on medicines. Many side effects of medicines were there, and he was not writing the exams, not attending the college of 11th standard. But his mother was hoping that he should at least give one exam for my satisfaction. So she appointed me as a personal assistant, support assistant, we call it as learning support assistant. And then I started practicing this yoga therapy and my psychology, of course, psychotherapy also. That is my achievement, I can say. What was the mother expecting? He should go. He was not attending college at all because of the medicines. He was having the side effects and he was having a lot of sleep issues. Many issues were there. But when that guy and that mother came to me as a client, I was practicing here. What I prescribed to him, the patient with mental disorder having schizophrenia, was Surya Namaskar, sun salutations, then a lot of higher energy exercises, higher workout I used to do with him. Psychotherapy was going on, plus his medicines of psychiatry that were also going on, plus some of my homeopaths friends. With the help of them, what we did is we tapered his psychiatric medicines to the homeopaths medicines, and slowly it is not the one day process, it is a lengthy process, I should say. The exam after 6 months was there, and before 6 months that mother approached us, and then continuously, because this kind of people having the disorders, they are not able to manage their routines. So in this type of routines, we managed to do this yoga exercises, heavy workouts with him, psychotherapy, and with that, at least with the help of my personal assistants, he was able to write the exams. He passed the exams. His mother was happy. Of course, there are some features for learning for this supporting kind of, I mean, this kind of people, they get support from assistants like us, like the psychologist, and they are, while they are writing, if they need help, we can help them. Everything is there, but the patient with mental disorders is writing the exams only because we are practicing yoga therapy, psychotherapy, and the medicines. We were managed to do somehow, and he wrote the exams, and that was my achievement because of using this yoga therapy. So this was my whatever my I faced it, and that's why I said that client's mother told, one day she came to me and told me that yes, worth doing yoga, because after that what happened, when yoga was discontinued again, the disorder was, you know, that I'm not going to tell it more. You understand, if the prescribed medicines are discontinued, what will happen to a patient with mental disorder? So that also we are going to learn. If the mental disorders having anxiety, depression, small mental disorders names you might be knowing, what we are going to study. I think the time is over. I think the link will automatically switch off if the time is over. But this is all what we are going to study in our 1 month duration. Treat each disease with asanas, pranayama, meditation, study and analysis of lifestyle, diet, and various diseases. Apart from this, we are going to study the energy chakras, mudras, bandhas, and then how to meditate. The meditation processes also we are going to learn. And apart from this, we are going to experience the divine energy through our 1 month duration course. So I rest here, and I want you to ask any doubts if you have, or if the session ends. Meanwhile, I mean, you are talking, and if the session ends, you can write directly the doubts to the WhatsApp group when you register to the course. So move on. Now it's your turn to ask the doubts. Any
Ma'am,
of you have any doubts about this?
will you also teach little about doshas, three doshas?
Yes, three doshas are there. Yes. I told you, no, the samadhatu, samadosha, that definition itself is there. So we will learn slowly. Everything will be there. Vata, Pitta, Kapha, one chart is there. I am going to share that I am going to teach. Then what else? Any doubts?
एक्सक्यूज मी मैम,
हाँ.
मोनिका, हाँ जी मोनिका
Yes.
मैम, मैम जैसे अगर पेशेंट वो आते हैं तो उनको जैसे हमने कुछ भी बताना है, आसन प्राणायाम बंदास, तो उनको हमने सिर्फ बताना ही है या उनको करके भी दिखाना, उनको गाइड भी करना है, उनको
See,
प्रैक्टिस भी करवाना पड़ेगा डेली?
unless and until we practice, we are practitioners. What is my mentality is to align with that client, you practice in front of him. Because अनुकरण ही एक चीज ऐसी है जो लर्निंग, we can say learning style होती है सबकी. As a psychologist, I'm saying we had an experiment of Bobo doll. If you search it on Google, Bobo doll experiment, you will come to know what I'm saying. Behavior itself is a learning process, and learning style is anukaran. By visualizing, by seeing the things in front of us, they will automatically learn, and they will get the energy to practice whatever you are teaching. So we are going to do practicals also in this course.
Okay.
Whatever difficult you will feel like, no ma'am, you teach me this asan, whatever difficult you will feel like, I'm going to teach, or I'm going to place any one of you here on this, because I am talking a lot. So while talking, if I am not able to do the asan pranayam, whatever, I will place amongst you only. So we are going to do practicals.
Daily we should bring mat, ma'am.
Sorry, Geeta ji, come again.
Daily we should use mat, yoga mat. Daily we should have.
I will tell you, because first sessions will be like learning pranayamas, mudras, bandhas. So I will tell you, if mat is there, it's fine. If not there, I will tell you, please be ready with the mat tomorrow. Like that, I will tell you.
गुड इवनिंग मैम। मेरा
Yes.
क्वेश्चन ये था कि ये जो आप सारे थेरेपीज वगैरह सिखाएंगे, जो भी इसमें जो अपना खाने का जो प्रोसेस है ना, वात पित्त कफ के हिसाब से हमें कब क्या खाना चाहिए, ये
Yes,
सब
yes,
इसमें
that also we are going to discuss. वात प्रकृति है तो आपको डाइट कैसा रखना है, योगा कौन से करने हैं, क्योंकि वात प्रकृति अभी आप पूछ रहे हैं तो एक एग्जांपल बता देती हूँ। वात प्रकृति के लोगों को हेवी वर्कआउट कभी भी नहीं देना है while practicing yoga also, because एक डायरेक्टली वात प्रकृति का रिलेशन होता है बीपी से। हेवी वर्कआउट उनसे करवाया तो उनका बीपी लो हो जाएगा वात प्रकृति का। सो
लेकिन हम
अकॉर्डिंगली वी विल स्टडी। सो वात प्रकृति है, आपको आइडेंटिफाई करनी है तो कैसे करनी है, बिकॉज आयुर्वेद में हम लोग नाड़ियां देख के करते हैं, साइकोलॉजी में हम लोग बॉडी स्ट्रक्चर देख के करते हैं, तो दोनों तरीके में बता दूंगी। एंड वन बेस्ट थिंग इज कीप अ फ्रेंड ऑफ योर्स in a ayurvedic, in a homeopathic, friend of yours. Why I am telling this, because whatever doubts we have now, we can ask our friends easily. If he is a ayurveda practitioner, he is going to tell you yes, this is correct, so you will get the confirmation, because you and me are not a doctor. You and me are yoga therapist. So we should confirm ourselves. Yes, this is it. We are going to learn Vata, Pitta, Kapha, accordingly diet also, and accordingly how to identify that this is Vata Prakriti, this is Pitta Prakriti. Everything we are going to learn.
नहीं, जैसे अभी हम योगा करवाते हैं तो जो पूरे दिन का जो खाना होता है ना, जैसे हमें सुबह सुबह
डाइट
में
देना
कफ
है।
प्रवृत्ति
हाँ,
रहता है,
उनको
उग्र,
डाइट।
तो वो टाइम पे हमको क्या खाना है, फिर दोपहर में पित्त प्रवृत्ति उग्र रहता है, तो ये वो जो पूरा 24 घंटे का जो पूरा वो होता है ना खाने का शेड्यूल, वो
हाँ,
नॉर्मल सबके लिए जिनको कोई वात पित्त
समझ गए,
प्रकृति
समझ।
का नहीं चाहिए वैसा कुछ, वो डाइट चार्ट इसमें आप बताएंगे ना?
हाँ, yes, of course, I will try to share all of your, I'll try to answer all of your doubts. And if not, all of the network is there in Shubha Yoga Foundation itself. Like our staff is like, you might be knowing Shubhi ma'am if you are attending the Shubha Yoga Foundation. She is good enough in Shat Kriyas. And that Shat Kriyas, if she is ready to teach, of course, this therapy course also Shat Kriyas, Nauli, Dhoti, everything. If she is ready to teach, I'll ask her to take one session for that Shat Kriyas also. So accordingly, we can plan in this 1 month duration. Therapy itself, patients when come, you should know about the diagnosis of patient, what treatment you should give to the patients, then how to cure the patient, because yoga therapy is an alternative therapy, we can say. It is not supposed to prescribe to anyone. That client's case study, history, you should be knowing. Then if the laboratory test reports, x-rays are there, you should be strong enough to read them. If you are not able to read, just ask your Ayurveda friend or MBBS friend who have done this degree. You can ask it and get confirmed that yes, this x-ray report. And that's why I am saying in 1 day or in 1 month, you are not going to be a yoga therapist. Don't mind. But whenever you will take more and more clients, accordingly you will get to know what to do with this client. You will study a lot in this 1 month duration, but while you are practicing yourself with the clients, you will read whole book as a client.
We can start from our home itself, from our
Exactly,
elders.
well said. Who is that? Geeta ji. Well said, Geeta ji. Ourself, we can start it, because originally we are healthy. We know what is imbalance inside our body. Our body knows actually what imbalance is there. Accordingly, our body wants the diet also. Sometimes we feel like eating what it calls. Sometimes we feel like eating sour taste, right? That body is attracting that, because that body's need is that to eat sour. So this is how our body has the study itself. We should be aligned with the body so that we can, attract the anything, whatever yoga practices or food or whatever diet it is.
It will give us some confidence to treat the clients.
Exactly. Thank you, Geeta ji. Well said.
Ma'am?
Some people are with, they come to us who are having surgeries in their knees. So that time,
Ma'am?
what should you do? है ना, नी पेन है, उनका सर्जरी हुआ है, तो वो टाइम आपको क्या प्रिस्क्राइब करना है, उनसे अगर आसन प्राणायाम करवाना है तो कौन से करवाने हैं, ऐसे केस स्टडीज हम इस कोर्स में सीखेंगे. अस्थमा पेशेंट्स, then which pranayama you have to give them, right? So these all will be there in this curriculum.
Ma'am?
Yes.
Ma'am, would we learn that zone therapy and acupressure and that cupping therapy?
Acupressure, I will ask Rajiv ji if he is ready to take one session for the acupressure. We will definitely keep it in our 1 month duration. But this course curriculum is not supposed to teach acupressure, because acupressure and mudras, this course, Rajiv ji and Shubha Yoga Foundation, these courses are different. So you can learn from there. But yes, mudras and all I'm going to teach you. So mudra therapy will be there from my side.
So does
Ma'am,
sir teach?
Can I practice? Yes, sleep disc and is best. Yoga is best for sleep disc. That actually I wanted to run this slides, but I did not share the screen. 8th of January, I am going to run this slide so that you will come to understand. That was the question from chat box. Yes, Anchal ji.
only one doubt, ma'am. Only a
Ah.
final doubt. Actually, I am practicing yoga, not yoga teacher. Will this course suit me? I am doing for 1 year.
You are not a yoga teacher, but will this
I am
course suit me?
practicing
Yes,
for 1 year.
yes, of course.
I
Why
have
not?
completed pranayama and meditation course and pranic healing.
Very good. So additionally, you can use the pranic healing you are doing, right? So additionally,
Yes.
you can use the yoga therapy. You can learn yoga
Okay.
therapy and you can practice with your clients. It is very
I know
best.
about chakras alone in detail. That's it.
Chakras and
Okay.
all will be in detail. Yes.
Okay.
Energy chakras, then vata pitta, that 3 doshas, then mudra therapy will be there, pranayama will be there, meditations will be there, yoga nidras and meditation has the difference. So meditations and yoga nidras, with the meditations, what affirmations you should give, that I will teach. Everything I am going to teach.
So does sir teaches that zone therapy and reflexation therapy, cupping therapy?
No. I will
Sir?
ask him about the same, but till now, what I know is no. Zone therapy and reflexation therapy is not there.
No, another course is there for that in that sir
Till
teaches.
now, no. Zone
Achha.
therapy reflexation is not there. You can discuss with Rajiv ji.
Okay.
So I hope you all liked this session and many doubts will be there, I know. Join us from 8th of January. While ending our session, we will go through a slok, and that is Om Asatoma Sadgamaya Tamasoma Jyotirgamayam, and then we are going to end our session. I think the time is over. We will end our session now. Breathe in, breathe out. Om Asatoma Sadgamaya Tamasoma Jyotirgamaya Mrityorma Amritam Gamaya. Om Shanti Shanti Shanti. Breathe in, breathe out. And thank you all of you. Once again, congratulations to all of you for taking the decision of joining this session. And Happy New Year. Bye-bye.
Thank you, ma'am.
Happy New Year, ma'am.